Hello, everybody. I'm Christoph from Hypnotherapy. Hi, I hope you are all well. Whether you're watching me live, thank you for joining me, or on replay, that's fine. Thank you for catching up. So, today I'd like to talk about something a little bit different because most people, when they think about hypnotherapy, they tend to think about stop smoking, getting rid of phobias, managing anxiety, and yes, it's very useful for all those things. It was very well for that. But few people know or even think that hypnosis can also help with pain management. So that's what I'd like to talk about today. Pain management. Should I be here as a banner? Or not? As if by magic. There we go. There's just a bit of a satellite lag, I suppose. So today I would like to talk especially about managing chronic pain. And although hypnosis can also be used as an anesthetic for medical procedures, that some people have been brave enough to use hypnosis to have operations or dental procedures being done. And also it can be used in situations where you can't be anesthetized. For example, if you're having a tattoo being done, you can actually numb your arm, numb your legs, so you can have the whole experience, the whole tattoo done painlessly, not painfully. So anyway, back to chronic pain. Chronic pain, as this lady is showing here, is a kind of complicated and unfortunately quite common condition. It affects your life, it affects your independence, and as well as a continuous pain can also have a major impact on your mental health, simply because it's exhausting. And so how can hypnosis help with that? Well, it's not about healing the body with positive thoughts or magic or even pretending that pain doesn't exist, but it's rather about changing the perception of pain. But to start with, you really need to understand what pain really is. And to put it simply, pain is just a signal that's sent to your brain and is then interpreted by your brain, filtered, and either ignored or amplified depending on the context, depending on the situation. And if you want to have more detail from someone who's actually qualified to talk about pain and neurology and all of those things, there is a video I will strongly recommend you watch by, here we are, no, this side, Professor Lorimer Moseley, who is a professor of clinical neuroscience in Australia. And he explains it way, way better than I can in a video. And I've put the link in the description of this live anyway. So I do recommend you watch it because it's really educational and so quite funny as well at the same time. The guy is very good for that. But in a nutshell, the brain can minimize a sensation if it thinks it's irrelevant. Like, for example, you just scratch your leg when you're hiking, or maximize it if it thinks it's a danger for you. For example, a life-threatening snake bite, like the Professor Moseley explained in his video. And in emergencies as well, the brain can actually totally block the pain signal so you can focus on saving your life or someone else's. So it really can do that quite efficiently in the right situation. But also, unfortunately, the brain can get confused and get it wrong. That's why you can even feel pain on limbs you don't have anymore. It's called phantom pains, for example. And you can actually have pain in a fake arm. And there's a lot of experiments done in that when you confuse the brain into thinking a plastic arm, a rubber arm is yours, and they hit a hammer on it. It's not a nice thing. But if you don't believe me, anyway, just watch the video I mentioned, and it will explain things way better than I can, so I stop waffling about that. But the main thing is that a lot of people confuse pain and injury, mainly because they often appear at the same time. But really, pain is merely a warning for your brain to tell you to stop doing something. That's why you start aching after a long workout, or when you try to lift something too heavy, it stops your muscle from going too far. Or actually, if you have actually injured a part of your body, it stops you from, for example, walking on a broken leg, which will make things worse. But just to demonstrate the difference between pain and injury, a simple example, just pinch your heel up as hard as you can, and it will quite quickly become painful even before you enjoy yourself. Well, I hope so anyway. If not, you pinch far too hard. But so in a sense, it's a warning signal. But obviously, as we all know, it is a very, very unpleasant signal designed to make you stop what you're doing and notice. And it can really make your life a living hell if it's always present in a chronic fashion. And pain is also very, very subjective, and the brain can interpret the same signal very differently depending on context. And that's something we can then later on exploit, actually. But there are two types of pain. There's acute and chronic pain. I'll ignore emotional or psychological pain here for now. So acute pain is what everybody think about is a result of an accident or temporary illness. In that case, your doctor will just make a diagnosis, suggest ways to manage the pain, help you heal, and you're going to get better, or you might just get better on its own as well. And it's generally short-lived, and it's just there just to stop you from overdoing it. That's fine. That's one is okay. Well, you don't like it, but it's okay. It serves a purpose. Chronic pain or long-term pain is often more complicated, really. It can be the result of a medical condition, permanent injuries, and actually sometimes there could be no reason at all behind it. Now, that doesn't mean the pain is unreal and the discomfort is unreal. It's just make it trickier to treat, really. So there are some illnesses and conditions that are well known for causing pain in a chronic fashion. You've got arthritis, you've got cancer, you've got endometriosis, you've got fibromyalgia, you've got MS, you've got sciatica, and so on, and so on, and so on. Actually, there may be some of you watching it who have your own experience, in which case, just let me know. But so you got all of those things, and actually, there's a lot of often medical condition behind it, and that's why anytime you experience any kind of unusual pain, you are always advised to visit a medical professional, because and then be able to investigate further and just double check there's nothing more sinister behind it. Okay, but unfortunately, sometimes, too often maybe, all you can do is manage the pain and learn to live with it. And that's when you start considering pain management. So you've got a very tempting way of doing it, which is bed rest and not moving. But if you do that, the problem is your body will rest, but also not do anything, lose its strength. And after a while, you might actually make things worse. So for some condition, what you want to do actually is to have a gentle activity and movement. Obviously, you can see a physiotherapist for that to help you have the right one. And just keep your body moving gently and safely, just to help the body heal better and so feel better. But the most common one we all think about and we use a lot more is just using painkillers, just going for the chemical option. And painkillers can be very effective. However, it's important to use them safely, as they can have side effects. They can affect your body, they can affect your liver and everything. You may also build up a tolerance to them or even addictions to them. Also, the surprising thing I've learned quite recently is that no one really knows for sure how paracetamol works, which is quite surprising. It's such a common painkiller we all use all the time. Anyway, so chemical pain management is still evolving even right now. Now, I'm not anti-med, by the way. I'm not here to tell you to take painkillers or not take painkillers or to change them and you take. No, I'm not going to do that. It's out of my skill set. So consult your GP about it. They are qualified for this. I'm not. So, and if you need to take painkillers, do take them. Follow the doctor advice always. But so once you've done all that, and if it still doesn't work, or if you don't want to take painkillers, your choice again, you can use hypnosis for pain relief. And that's because the pain signal is processed by the brain. Therefore, if it's possible to affect the brain, you can affect how you process it. And there are various techniques to help you do just that. Now, the simplest way you can help with pain is just learning how to relax despite the pain. Now, it can be quite tricky sometimes, depending on how much discomfort you're experiencing. But if you can learn to become more relaxed, or as relaxed as you can, lower the anxiety that's been created by the pain, you can really make things better, because most pain sufferers become hyper-vigilant, and they can inadvertently make the pain worse than it is, because the more you focus on it, the worse it can get. And your attention to the pain can amplify it, really. And the more you focus on it as well, the more you reinforce this neural pathway that makes the link between that sensation you feel and, oh my God, it's really, really painful, it's unbearable. So it can really become quite easily a vicious cycle. And you don't do it willingly, by the way, but it's a pattern that happens quite easily. So yes, as I said, stress and anxiety are also a common side effect of pain, making things worse. So if you can manage all of that and relearn to just lower it a bit, relax a little bit at least, even if you can't be fully zened out, that will help you make it more bearable at the very least. Another technique you can use is visualization as distraction. Yes, of course, the pain will still be there, but your brain will become too busy to fully process it, and it makes it more bearable again. If you think of it, a lot of chronic pain sufferers will do anything they can to just think about something else. They will watch movies, read books, play games, anything they can do to keep their mind occupied on something else. So if you can't logistically do that, because, I don't know, you're at a place where you can't read or watch a film or anything like that, you can learn to zone yourself out and just guide yourself somewhere else. It's also a useful way to make a tattoo more bearable, or visit a dentist more bearable. You can really zone out, go somewhere else, go to a place in your mind whilst they're doing all their stuff, whether they're pulling teeth or scratching you with a needle. So you can actually create temporarily anesthesia if you want to have a tattoo with hypnosis. It's quite easily done, but it's just temporary, obviously. So in some cases as well, it's possible to actually retrain your brain to change how it's processing the pain signal altogether. Because I think sometimes the pain is nothing to do with injuries anymore. It's a leftover after an injury that's healed, or medical condition that's cured. It's a bit like if you got a problem with your car, you get it fixed, but the mechanic forgot to reset something, and you still got the light on your dashboard. That's an oversimplification, but I think that explains it quite nicely. So you got the body as well, maybe still overprotective and wanted to avoid you to repeat whatever you've done to stop you from injuring yourself again. And it's more common than you think. And in that case, as the issue is genuinely all in your head, although still genuinely really painful, it's possible to free people from those cases. But even if you still have an underlying condition, some are able to mute it for a while, and others can actually change the quality of the sensation. So you can turn it from something very painful all the time to being a sensation of pressure or heat, for example. So you can still have the information that you have to be careful, but without all the over-the-top unpleasant side effects. So yes, brain, I got the memo. My bad is back. I shouldn't go and do cartwheels. Thank you very much. So you still got that job being done, but more importantly, you still notice if anything changes or is getting worse. And most importantly, you can start regain some comfort in your life. Now, everybody is different, so the level of comfort regain will vary a lot. But a lot of people are genuinely surprised how rapidly they can feel better, obviously with the right help and the right technique used, obviously. So one thing which is important to remember is removing the ability to feel pain permanently will be a very, very bad idea. And that's not what we're aiming at here. If you manage to control the pain in your back, but you then hurt your back again, you want to know about it, okay? Because you want to stop what you're doing. And some people actually have a condition where they can't feel pain at all. They're totally impervious to pain. They don't even know what it means, like what it feels like. And that can be life-threatening for them because they don't know if or when they get injured. So it's really, really bad. So the aim of hypnosis and hypnotherapy is all about getting relative comfort and regaining freedom from pain. The nature of hypnotherapy means that, yes, it may not work for everybody. However, it's a natural therapy with no side effects. So it's really, really worth trying. And many people report it's an effective tool to use as part of their chronic pain management. So that's all I've got for you for today about this. So thank you very much for watching. And as usual as well, please, yes, there we go. Please like, share, subscribe, whether you're watching it on Facebook or on YouTube. If you're watching this on replay, please let me know, #replay, so I know you're thinking about me and you're following me. That make me smile as well. If you have any questions or anything you want to ask, whether it's about pain or hypnosis or hypnotherapy, please feel free to ask me in the comments and I will be happy to respond. So thank you very much for watching and see you next time. Bye.